Good morning. I'm Maureen Henry. I work as the laboratory supervisor. I've been at this hospital for 29 years. I started as a medical technologist. I came from the hospital in Miami, then I came straight here. My main role is to assist my manager with the daily operations of the lab. I do certain things such as keep up the quality control and inventory and assist with the needs of the employees. You tend to develop friendships, and also, we care for each other, so I've seen people come and go, but then there's some core ones that are still here that we always keep in touch with, and that, we absolutely care for each other. I mean, we have a lot of teamwork here. Science plays a big role because a lot of the basic courses that we do in school, such as, doing chemistry and learning about formula, we have to apply that here in the laboratory, because when we're dealing with certain acids, we have to know how to treat them, because some are toxic and some, can burn, so we have to definitely know what we're dealing with. We have a material safety data sheet that if we're not, if we want to get familiar with the chemicals, then we can read it. So it does play a role in, the daily processing that we do. We exercise precaution. We wear our PPEs when we're dealing with specimen. And also when we're dealing with chemicals, we know that we have to also go behind the hood and, do the other necessary precautions. We consider ourselves like, behind the scene detectives, in the medical field, because, not many people will see us every day in the hallway, or because we don't have much interaction with the patients. So when we do the detective work, it's like then we're helping to solve a case for the doctor, but they don't see us. They'll hear us on the phone, what we call critical values, or if we discover something on a slide, we mention that. But so I would say that we step back a lot, but we're in that role. We're like detectives. When I worked at Jackson Memorial before I came here, and we had we had a kid that had Burkitt's lymphoma, and I used to see that in textbooks, that how the cell looks, but when we actually saw it on the slide, I was like, that's my first time when the pathologist that works there said that's what it was. I said, wow, I finally saw one on a real slide. The pathologist, okay, that's the medical, he's the medical director for the laboratory, and the pathologist does cases for like cytology and histology. I will ask Lisa to help me with that also. Am I on the right track, Lisa? Yeah. So the pathologists, they look at cases that deal with cell cytology and histology to do with smear. They do a lot of smears, a lot of the biopsies that they do in surgery. They look at the slides to determine if it's benign or cancerous, as well as other things. But yeah, the pathologist is a physician, but their specialty is with cytology and histology. Familiar with what we do here in the lab, and so there is a shortage. And so I would like to reach out to say, anyone interested in joining the laboratory, don't be fearful, that it's a rewarding field.